Thanks for tuning in to this special edition of the Best Practices Show podcast. This year we were presented with something we didn't expect, which was a pandemic, and a lot of us were shut down. During that time, we put together a COVID-19 dental relief conference, and we had some of the greatest teachers in all of dentistry come forward to inspire this incredible industry. In this series, we're going to go back and take a look at the best of the best from the COVID-19 Dental Relief Conference. We hope you enjoy it.
What I thought I would do, this is actually something I've not shared with on any webinar or actually in any course. So Kirk, I'm doing it just for you.
Thank you.
But what I decided to do is, there are just so many webinars out there. Actually, I have taken what has happened to us with COVID-19 and framed it into the stages of grief. It's somewhat of a parody. I probably need some folks like it, so I may put it on my Facebook page, but it goes all the way from beginning with denial, like, nah, this is not going to really happen. I'm sure I'm going to be okay, to anger, are you kidding me? All the way to depression, and then I do the 3 stages of acceptance. But we're all on the same page. If there ever was a time to truly have efficiency in managing a dental practice, right now is that time. I don't wish COVID-19 on anyone, past, present, or future. But I do know one thing it has done. It's helped us clean up our act a little bit. What I hear is, maybe I didn't need 20 team members. Maybe I didn't, maybe I didn't, maybe I didn't. So this is going to be fast and furious in the next few minutes. I'm going to provide with you what I think, there are more than 4 pearls, but these are going to be pearls, and some of these are going to be outside of the box. So sort of just fasten your seatbelt. Some of it maybe you're going to say, are you kidding me? But I've been at this a while, and I did manage a very, very, very large practice. I might have mentioned before, I had 25 practitioners, 43 operatories, 12,000 square feet. I practiced perio in that, plus I was the CEO. So to a certain degree, I do look at things not only from porphyromonas gingivalis, but you got to make money. And so my 3 mission statements always in any practice I go in, and I do a lot of perio consulting, and is 1, high quality care, 2, be happy doing it. And Kirk, your points were right on target. And 3, be financially responsible. So let's get to it. This is me. I moved away from totally being at the university about 8 years ago, set up my own consulting. I had been involved in organized dentistry. I love it. I really appreciate what the ADA has done in the last, and AGD has done in the last 6 to 8 weeks in helping us. They do, we owe them a round of applause for that. But I made a decision to start moving into more consulting, and not only for practices, but also for companies. Having said that, when I speak about these things, you'll know that I have some relationships with them. Florida Probe, I helped start that company a few years ago. Perio Sciences, BioLays, Phillips, ProBio Health, and also a little bit of Hugh Freedy in the mix. They're going to be, this is the educator in me, there are going to be 4 things that by the time we finish, I would like for you to at least digest it. Now, please understand that Each one of these could be a webinar within itself. And as I always do, if you want this presentation, I will give you my email at the end, and I will send you every single slide you're seeing here in color. And so there are 4 things, and naturally there are the 4 pearls. 1, we need to rethink the way we're doing the new patient examination. Every single time I go into a dental practice, that is where I hit the brick wall every single time, is the new patient. Number 2, I want you just to think a little bit outside, and I'm going to share with you some things about dental assisted hygiene. 3, this is going to get some of you a little intrigued. I'm going to push that some of us need to be thinking about a retail center within our dental practice for oral hygiene aids. And I'm going to give you an example of why I think that is very viable for some of you. Some of you may decide that's not where you want to be. But I'm going to give you some things to think about. And lastly, there's this appointment that we call the recall appointment, and that sucker is always down at the very bottom. We call it the cleaning appointment. It's like me going to McDonald's and getting a Big Mac. And I'm going to demonstrate for you that that could be one of the most critical appointments in your dental practice. It's where we build relationships, but I'm going to show you also from a monetary standpoint of the things that I believe that we need to consider changing moving forward. This is not us. It may have been us a while ago, but this is not us now. This is us, where we look at quality, we look at being happy, and we also look at growth from the standpoint of financial. When I was talking with Roger Levin, must have been more than a decade ago, he popped up this slide. The greatest potential is periodontics. Assessor fee for periodontal probing. Diagnosis must be the forerunner, and I don't mean going back to dental school and hygiene school. Got to use high technology tools, especially now. But that last one is something that I do a mantra with every morning that I get up. You want to change a habit. You want, whether it be your habits, your team habits, your patient habits, your family habits, don't assume they know. You have to educate. I just don't want to spend the next 20 years educating everyone. And this is not dental school or hygiene school. We don't have 20 minutes to talk about bugs and hosts and things of this nature. So you're going to see a lot of scripting. So let's get right down to the meat of it. These are 4 things that if you haven't looked at your practice from the standpoint of hygiene, you need to do it by Monday. What percent of your gross comes from dental hygiene? It should be 25%. My friends, if it's running 40%, you know what's happening? You're not producing. You say, well, Sam, we must have a great perio program. Well, maybe you do. But anytime I see somebody at 35, 40, 45% of hygiene of your gross, you're not producing. There's an issue there. You should be around 25%. Less than 25%, you're doing prophies where you should be doing perio. So you say, I'm getting right between the eyes. I've only got a few minutes. What percent of your dental hygiene are perio codes? That should be running around 40%. I'm going to show you how we do that formula. What percent of your new patient exam should have a perio exam in it? 100%. What's your cancellation no-show rate? Many of you don't know that. Every time I've ever gone into a practice and I said, what's your cancellation no-show rate? Every time anyone has ever come up with a number where they hadn't really calculated it, it was always a heck of a lot more than they thought. They said, well, we do real, real well. Well, I'm sure it's probably around 5, 6, 7%. No, my friend, it was 20%. And guess what? Anytime that hygienist isn't seeing a patient, you're losing twice. We'll talk about that. So let's dive right into number 1, new patient exam. Many times, here's what it is. Well, who sees the patient on the new patient exam? Is it the dentist or is it the hygienist? Well, Sam, it sort of depends how the day is going. It kind of reflects back to Kirk, where Kirk says, at the end of the day, how do you feel? In my mind, I've always said it was 2 things. You either have a nirvana day or you have a cardiac day. Kirk was trying to push you towards a Nirvana day. He's right. You know, I remember when I was practicing, I would drive home. And, you know, it was only about 20 minutes, but I actually reflected. And there were times that I said, whoa, I can't wait to get back. And there were times I said, you know something? I should have sold this practice a long time ago. I cannot go through this again. But you know, some of you out there, you've been going through cardiac days for 20 years. I don't know, maybe you just want to beat yourself up. But I think Kirk, Mark, and the rest of us, but we want you to be happy. We want you to be successful. Please understand, I believe that all those folks on this panel today and all the other speakers of that, we do one thing. It's where it comes from, this little pin here. It's from Dr. Pankey. Do what you do best and the money will come. I absolutely believe that. I'm a testament to that. If I'd have known what I could do, I would have quit that university 20 years ago. So from the standpoint of what you want to do, when Toyota makes a Camry, they don't say, well, you know, if the person's not busy doing the windshield wipers, well, then we can get somebody else that's doing the steering wheels. Are you kidding me? Why is Camry the #1 automobile in the world on reliability, customer satisfaction? And why we always buy those for our kids, because we know they're never going to change the oil. It's because the way it was built on Deming's model of social economics, which is flowcharts and process. You see, if you have really good process, then it gives you the opportunity to do what? Have really good relationships with your patients. You say, Sam, are you just going to put everything in a cookbook? No, but I don't want hygienists coming up and say, well, what do you think we ought to do about this, Dr. Lau? What do you think about the dental system? What do you think we ought to do? The whole time I'm answering that, which is on a flowchart, I'm taking away from my time with the patients, doing the things I want to do, and I end up with a cardiac date. So let's talk about the new patient exam. New patient exam. I have gone through every single system out there, my friends. I've done over 150, 200 in-office perio consulting, going into the office. Now I actually do it virtually. And if you want to know more, I can send some materials to you. What I have found, this is the magic. Number one, what does the patient want? What does a new patient want? I want a cleaning. And will my insurance pay for it? Those are the two #1 things that you will hear in a dental practice. I want a cleaning, and will my insurance pay for it? So what happens if you don't give them a cleaning on the first appointment? Well, if you have a really strong relationship practice in which like, those patients probably aren't expecting a cleaning. But most patients want something on the first appointment. This ain't dental school. So here's the only way I can figure it out. 2 units. Whether you do 45 minutes or 60 minutes, it's 2 units. And what I've done for you, I'm going to send this to you. I've worked a lot on this. Your participants are the dentist, the hygienist, the dental assistant assigned to the hygienist. You meet and greet. You don't have to have a dental assistant assigned to a hygienist to do this. You'll see what I mean by, but these are the things that you do. This is the hygienist. Now, this may be totally politically incorrect, but I'm going to say it anyway. I've been in organized dentistry, trustee ADA, Florida Dental Association, president AAP. But we are losing out by not maximizing what we do with our hygienists. They are not cleaning people. You know what they are? You watch. They're the nurse practitioners. They're the physician's assistants. And I'm going to utilize them for that. So here's what I'm having. That dental hygienist is actually taking over the new patient appointment, medical history, FMX, periodontal charting, dentist, and actually getting all the data. Then the dentist comes in, he or she does their exam, reviews the perio data from the dental hygienist, and on that second unit, we'll talk about that, on that second unit, that's where the dental hygienist does some form of debridement. I've looked at every single system out there this is what I recommend. So, first appointment, please understand, these patients want a cleaning. They don't want a $1,200 SRP. Are you kidding? They don't want a $5,000 gum surgery. They want a cleaning. And the reason they want a cleaning is because we don't educate them. We're going to educate them. Now, let's face it, they know more than they did 25 years ago because they got Google. And believe me, everything you say to them, they're going to go back and go on YouTube and find out. Just as an aside, that's why I stopped doing flap and osseous surgery with blades and sutures and stuff. And why I went to minimally invasive laser periodontal surgery, because the results are the same. So when we do think about this, if I was looking again at a growth center, my friends, you got the growth center. And when I was speaking at the last webinar for Kirk, I brought this out. What other thing do you want? You got 47% of the entire population in the United States have bone loss. And if they're 60 or 65 or older, it's 2 out of 3. But you got to sell it. You've got to sell it. And that hygienist now has to be what? Salesperson. You know, if it were me and I had 2 applications looking at what hygienist I was going to hire, but everything was exactly equal, but one of them sold shoes, sold insurance, sold real estate, sold Amway, I don't care. You know who I'm going with? I'm going to the one that sells, because they know elevator speeches. They know closing. They know how to do it in a professional manner. I didn't say mercenary commercial manner, professional manner. So you can talk about loss of teeth, talk about surgery. You have to, especially during this time, bring back the oral systemic link. And you have to, especially if it is a patient that has a systemic link. Please don't tell them they're going to floss or die. Don't do that. But please bring the relationships together. Talk about it as a persistent chronic inflammatory disease. Talk about it from the standpoint that the bacteria are only there to get it started, but their susceptibility and genetics, along with environment, is what perpetuates it. If you've heard me say this, I'm going to say it again. Stop using the word fix or treat ever in a dental practice. Always use the word manage. And if you use that word manage, think of yourself as a diabetologist, a cardiologist, a rheumatologist. They don't fix anything. We don't either. Let me have a tangent for a moment. Every time I turn around, Kirk mentioned this. How many new patients? How many new patients? How many new patients? How many new patients? How many emails have you gotten? Let me show you how to get new patients, new patients, new patients. Powerful, productive practices work on sustainability. Just as a tangent. I hope in the last 8 weeks, you know what you should have been doing? Calling every single one of your patients. I didn't say emailing them. Retaining your hygienists, and every single one of your hygienists that are assigned to every single one of your, calling them personally. I remember everyone who called me. My banker called me. Personal call. Sam, how you doing? Is there anything we can do? Personal call. And you know something? I'm going back to that bank. Even if the interest rates are higher or a loan, I'm going back to that bank. So it's about relationships. Here's the aftermath of this. When that patient leaves, they need to know that periodontitis is the loss of jawbone, number 1. And number 2, if they have a systemic condition, periodontitis will make their life shorter and more difficult. Those are the 2 things they need to leave. I showed this before. Now we're really thinking about this, aren't we? This COVID-19 comorbidity thing is something that we now have stats on, and even more stats. Look at these numbers. When you are over 59 going up to 80, that's where the percents of case fatality rates are. And notice where the comorbidities was. The comorbidities, my friends, are almost identical to perio. I need healthy perio patients being healthily systemic so that they are less susceptible to these kinds of infections. So when I say that first hour or 45 minutes of data collection, I'm not just talking about I'm talking about a checklist that a dental hygienist has. And these are the categories. And here's the checklist. Jane, who was your previous dentist? Any symptoms of gum disease? Has any dentist ever mentioned gum disease? When was your last cleaning? This, by the way, if you know this is all motivational interviewing. Anybody in your family, brothers, sisters, parents. And you know what? That hygienist is writing this down or on a keyboard or on a tablet. Tobacco use. Do you grind or clench your teeth? All of these are setting up what? Education equals treatment acceptance. Then you go to your data collection. Let's not go back to dental school, hygiene school. You know, sometimes people say, well, do you measure bleeding on probing at the new patient exam? My response is, you can get anything to bleed if you work at it. No, I don't, because it doesn't help me. I only collect data with things that help me. So therefore, I got to have radiographs. The dental hygienist is taking those radiographs, unless you're running 2 columns and a dental assistant is assisting the hygienist. But for most of you, the dental hygienist is taking those radiographs. What do you want is the key point of those radiographs? You got to see the bone. First of all, Delta's not going to pay for it, help reimburse unless you see the bone. You got to see the bone. You got to do probing. I don't care what probe you use, but you got to be able to see the lines. We always say the older you are, the darker the lines. This is my favorite. Nobody makes it better than Hugh Freedy. UNC 12, 1, 2, 3, 4, 5 blackers, but you can have different probes. You can't have a 3, 6, 9, 12 probe, a thick probe, a thin probe. Mixed all with these probes or don't do the exam. The dental hygienist has the time to do the exam. Listen, if you are a dentist and you want to do periodontal exam, be my guest. I don't know why, because I'm a periodontist. I don't want to do it. I don't want to take out a spear and stab somebody 192 times. That's what I got a dental hygienist for. And guess what? Sorry, dentists. Most of the time, the dental hygienists know how to do it better than us. So then you got to have a chart. What's the end of that 45 minutes when that doc walks in? Got to tell you, got to have a chart. All I care about is, do I have bone loss? Do I not have bone loss? If I do have bone loss, where is it? That's why I love Florida Probe. We now have VoiceWorks. If you have VoiceWorks, you need to look at VoiceWorks. I just got a testimony from a dentist who's back at work. He said, Sam, I have no earthly idea why anyone who does periodontal charting would not use VoiceWorks. What more could you want? You put a microphone on, works with any software that's Microsoft, Eagle, Dentrix, anything. And all you do is you talk. And when you talk in it, guess what? It gets on the chart and it understands your voice. What more could you want? You're not leaving the mouth to do that. First of all, you got a real issue doing that now anyway because of PPE. The other thing I want to ask you to really put in that 45 minutes is some type of susceptibility resistance charting. I don't care how you do it. This is one, the older you are, the more local factors you have, the less periodontitis you have, the more resistance you are. It doesn't matter to me. Younger age, few local factors, a lot of periodontitis, but you've got to have something out of that 45 minutes that shows that. And with it, here's one I love. It doesn't cost anything. This is excellent for oncology, caries, and perio. It's Previsor. It's been around for 10 years. It's outstanding. And it gives you a great chart. So from that 45 minutes to that 1 hour, now your patients are put into 4 buckets. Yes, I'm going to be really simplistic. There are 4 buckets, my friends. 50% of your patients are gingivitis. Tell me who's are 2, who's are 3, and who's are 4. That tells me our treatment plan. Because for every one of those, that next 45 minutes of that 2-hour appointment or hour-and-a-half appointment, that cleaning is dependent upon what those 4 buckets are. See, I'm building a Camry. Now, you may ask me about the new AAP, was 2018 now. I don't use it. I still go to Sam's 4 buckets. So those buckets tell me what kind of debridement we're going to do, and actually also tells me what the instrumentation is going to be. So here's my gingivitis patient, tells me exactly what I should be doing. Here's my periodontitis patients, which are 2, 3, and 4. Tells me exactly how many units. Now, if they're a periodontitis patient, that second 45 minutes to an hour, you may only do 1 or 2 quads and then reappoint them. So please understand, there's a wiggle room in this. But by the time they finish, they need to walk out of there knowing this. Gum disease is the body's reaction to a stimulus that creates an overactive response that produces inflammatory mediators that destroy your own tissue. Friends, it's an autoimmune disease. So does this make sense? This is your second hour. I see I spelled gross plague, it should be plaque. This is an offshoot of the ADA, and I manipulated it. I hope this makes sense. This is the Camry. This is the second. What do you do in the second hour? Well, Sam, if they got so much plaque and calculus, I can't do anything. I do a gross debridement. Well, Sam, if they don't, then I go ahead and do my charting. And then that second hour, I got 3 possibilities. 1, I throw them into Profi. 2, I use that, if you're in the US, that 4346 code, scaling and present inflammation. Or 3, in that second hour, I start my first quad of SRP. Very simple, very straightforward. So in that second examination component of the new page, that second hour, these are the things you're doing, and I will send this to you. You're doing oral hygiene, etc. You're doing your instrumentation protocol. By the way, all oral hygiene should be done at night. You need to start driving compliance. I'm going to talk a little bit about oral hygiene here in a moment. But dental hygienists do periodontal examinations, review the production, use technology, educate patients, reinforce treatment plans, know your dentist. So let's talk about those hygienists for a moment. Very interesting time right now. I'm going to make a statement. Some of you probably aren't going to be thrilled about it. Dental hygienists, if you have anxiety and fear about going back to work, and you are working with a practice that has always had quality infection control, you have nothing to worry about. I've been through this HIV crisis in January 1990, especially in Florida. Read the science. Go back to work. So, I do appreciate that some of the things that is causing you is infectious diseases. But I also know this. Hygienists are critical in my business in putting perio into the practice of general dentistry. We can't do it without you. 40% of the services beyond the prophylaxis, 50% of the production you're going to see, this comes out of the hygiene laboratory. 30% increase in production using a dental assistant. I'm going to show you that. Take advantage of advanced technology. Follow the guidelines, you're going to be fine. These are my 3. Pre-rinse, reduce aerosols, HVE use. I didn't say eliminate aerosols. I said be smart about it. So now you see that the dental hygienist is not a tooth cleaner. He or she is someone who knows how to motivate, presentation skills, knows how to do conflict resolution. So when you look at what hygienists wish they could tell us, new instruments, new appointment, but you know the most important thing of every survey? Back me up. So, if you want to use manual instrumentation for the next 20 years, be my guest. It will not be as effective as ultrasonics, and I have the studies to show that. But I'm going to leave that up to you. This is the recent study done with Jackie Sanders that was in RDH. Will you be using ultrasonics? Not sure, 34%. Yes, 28%. No, 38%. Will you have HVE to use with your ultrasonic? That better be 100%. I don't care what the survey shows. So just follow some guidelines. 60-second rinse, My suggestion is 1.5% hydrogen peroxide, 30-second spit, 30-second spit. That's where we're all going. Reduce your aerosols, drop your power down, drop your water down on your ultrasonics, and you got to use the right HVE. I'm indebted to Nancy Miller, works for Jameson and Hugh Freedy. Again, screenshot this or email me, I'll send it to you. We've been doing this for 4 years with Airflow. This is the systems that you use. There are hybrid systems using small tubing, using the right HVE adapters that are 8 millimeters or greater. This is where you buy it. I'm going to leave this on for a couple of seconds. But you see down the bottom here is this, this aspirator. It's very short. It's outstanding to be used. And this is the way we use it. You'll notice you've got to be within 5-6 millimeters of where the spray is. That also includes your dentists. We're using Optigate now, where dentists will be using rubber dam. For hygienists, we're using Optigate. So there's all kinds of systems out there for us to do that. Please don't use it like you see over here on the left, trying to spray the walls, spray the ceilings, spray the floors. We never recommended that in the very beginning. So, and if you're going to go to manual instrumentation, would you please go to the Gracies and use the micro thin after 5s? Don't use these things that belong in large animal vet hospitals. And I don't care whether you polish or not. Most practices stopped polishing a long time ago, only that for a stain. So now let's move into our next area. And that is about this whole thing with dental assisting hygiene. The number one reason dental hygienists run late, the number one reason is the doctor. The number one reason is the doctor. The number one reason is the doctor. One of the problems also is, here's Nancy Miller writing in RDH 2016, 34 services that we're expected you to do within an hour, plus wait on the doctor. So what I began to look at about 3 years ago for both private practices and DSOs is systems called dental assisted RDH. By the way, you put this in to Google, you'll get 30 articles on it. And you can just digest, or you can contact me and I can tell you what I'm thinking. The most popular is the 1 dental assistant, 2 RDH, 2 columns. The next is 1 DA, 2 RDHs, and 3 columns, which by the way does work. The first few weeks is chaos, but it will work. What I've been working, especially with some DSOs, when you can build this out, and this is outstanding, but you've got to have a physical plan to do this, is 1 DA, 1 RDH, and 2 ops. But you have to be able to build that out and have those extra operatories. And one DSO that I'm working with, we are seeing 16 patients a day in 2 ops. And everyone is really, really happy. So when you look at patient flow and you're looking at where that dental assistant is, it's from escorting, turning over the room, hygienist finishes the clinical duties. These are all methodical systems. Assistant, whatever delegable duty in your particular state that a dental assistant can do, that's what he or she's in there doing, while your hygienist is in the other operatory doing the other things. So you begin to do these things in sequence. Again, I could do a 2-hour webinar on just dental assisted hygiene. But the bottom line is, it's just working the system and working the schedule. Now, I got this from Nancy, who also got it from Diane, so now we've plagiarized like 3 times. But I could create this whole thing for you on a spreadsheet. It's not magic. The whole bottom line about all of this is this. You will not only pay for the dental hygiene assistant salary, you will not only have nirvana, you will also make more money, even paying for the dental assistant. And then just this one system, $41,000 extra profit annually. So it's not just about quality of care. It's not just about happy doing it. It's also that you're going to pay not just for the dental assistant, but you're going to end up with at least $42,000 more. So but it has to be set up. 2 treatment rooms, comparably equipped, a teamwork atmosphere, a treatment planning type of practice. I did not want to leave this. I hope you appreciate the value added revenue and benefit for any of those 35 plus states that are out there to utilize the lasers in the hygiene operatory, especially in the 2 areas of my favorite, which are laser bacterial reduction and laser curettage. But if you've never used a diode laser on a herpetic lesion ephes ulcer and see the result in 24 hours, actually immediate decrease in discomfort, please look at diode. And so here is a dental hygienist. This is Lynn Atkinson in California, Southern California. I work with her, and here she's using a diode laser, and I can promise you that patient came in with discomfort. They left with no discomfort whatsoever. So this is, again, laser bacterial reduction, laser curettage. Many practices for LBR are charging $30 for a full mouth, $50 a quad for a laser curettage. And let me throw one else thing in for you. If you're going to have to resort to manual instrumentation, you're not going to be able to disrupt the biofilms like you did with the ultrasonic. But if you use the laser bacterial reduction now with hydrogen peroxide irrigating into the sulcus, now you are not only where you were with the ultrasonic, you're actually more effective. And I can speak with you about that. So let me go to number 3. Patients will diagnose their disease condition. Now here's where I want you to sort of fasten your seatbelt. For some of you, this is going to be a little uncomfortable, especially generationally, but here we go. You ever been in Walgreens, a grocery store, CVS, Walmart, Target? You ever been in there? Mark's laughing. Ever been in there? See these people? You know what they're doing? I don't know what to buy. Well, Dr. Hyman told me to do this, but you know something? I don't know. He said to buy good toothpaste, there must be 200 brands just to Colgate. Oh, they told me to buy an electric brush. Whoa, my God, they range from $19 to $300. I think I'm going to get the blue light special with the 2 D-cell batteries for $19. Don't you think it's time for you and I to do something about this? I do. If nothing else, just to help our patients. So I'm going to now go into my number 3. Number 1 was new patient. Number 2 was assisted. Number 3, Pearl, is I want you to start thinking about retail center. Because here you got the manufacturer, here you got the patient, and in the middle you got you. And I must tell you that that patient does not have the education once they leave your office to go out and do whatever you want, unless you write it down. But if there's one thing I know in the last 5 years in our culture, as much as I like it and sometimes don't like it, you know what the word is? Convenience. Who's making out like a bandit in the last 8 weeks? I can tell you who. Amazon, FedEx, UPS. We should have invested in Zoom. Convenience, 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 convenience. Especially in what? Exer, millennium, and centennial generations. I don't care how you do it. Direct ship model, sell it in the practice, doesn't matter to me. And I can talk with you about that because I'm working on those systems. But I want to give you 2 examples. 1, if you've got a dog or cat, horse, a cow, especially if you go into a small animal veterinarian office, what do you look at? I can tell you what you're looking at is the fact that $55 billion in the US spent on our pets, $35 billion on food and vet services, $13 billion on supplies, $4 billion on grooming, 5% increase in spending. When I go into my vet office, here's what I got. They're not stupid. They've been doing this for at least a decade. By the way, I wanted to show you a graph. This is fairly recent. You see the little blue over there that says 5%? 5% is just the things that they buy just in food and some of these treat kinds of things. 16% is what they buy in drugs. So if I add those two together, that's 21% of their gross is what you see there. Example number 2. You ever been to a plastic surgeon derm office lately? I can tell you. You walk in there, you pay $200 for something they did on your skin, you walk out of there with it's not $200, $600 to $800, and you walk out of there with $1,500 to maintain it. I kind of know this because you see the one in the center? That's my dermatologist. That's where I got the idea. Look at it. You get something from, something from IKEA to something really professional. And notice, because I am one, and I know Mark is too, we think outside of dentists. We're reading things outside of dentistry. 5 missed opportunities. I know this is like, like we've done economics, this is like derm economics. Not offering both private label and skins in your practice, not promoting your skincare products, not having every staff member properly trained to talk about, not having actual product inventory, not having checks and balances. Notice at the bottom, skincare can be an incredible, profitable item in your practice that benefits patient care outcomes. Remember, it must be treated as a priority and not an afterthought. There is an art to doing this. And that whole art has to do with what you see with that big arrow. And so whatever system that you want, let's talk about that. This is the way the patient thinks when they walk out of your office, unless it's defined. So here we go. You, in my mind, should be considering selling, giving away, I don't care how you do it, electric toothbrushes. It doesn't matter to me which one. And I promise you, and you're going to see this in a moment, if you talk to any of these salespeople on any of these oral hygiene products, they have systems for you to sell these in, and they will show you the gross net margins that you have as far as quantity goes. Every single one of these companies have this, and they probably have already approached you. So there are systems, no matter what you have, no matter what you have, whether you want to give it away or sell it, whether you want to sell it wholesale, whether you want to sell retail, I'm going to leave that up to you. Personally, I think it'll be retail. But these patients want convenience. So 2 things are happening. One, they're actually using what you wanted them to use instead of going to Walgreens trying to figure it out. And 2, you are getting something from that. So therefore, when we look at that, here's the other kinds of products that are out there. These are products where you can't get these at Walgreens. This is Periosciences. There's a whole litany of products where people are coming to you and asking you to use these products for your patients, but you can't get them at Walgreens or Walmart. This is really where more margin is than any, and this is Periosciences. Periosciences is phenomenal for xerostomia. So if you don't know Periosciences, the margin on this, $43 for 8 weeks. For a retail, your cost is $21. Patient care is still number 1. Do what you do best, the money will come. I highly recommend Periosciences. Here's another one that you cannot buy in a retail store that's scientifically based. This is Probiora. Here are some of the others that are out there. This is probiotics, oral probiotics. And they will show you the ROI. Probiora will show you in a heartbeat the ROI that you will get from this. Now, don't sell things that don't work. Don't sell things just because you want to make some money. Sell things that do what? Complement your oral professional care. Highly, highly recommend oral probiotics. So my friends, if you want a screenshot, you can do this, or you can email me, because I'm not going to go through every single one of these little details, but this is what I need you to be thinking about. Staff training, if you're going to go into retail sales, is absolutely mandatory. Number two, clients listen, patients listen to your recommendations. How many times have you ever heard someone say, well, what do you use, doc? What's your family use? By the way, can I just say one quick thing? I learned this real quick. Don't offer folks 2, 3 different kinds of electric toothbrushes. Let me tell you why. Well, this one does this one and this one. Well, can you tell me now, what's that? What's the difference? No. The practice votes on the one electric toothbrush and that's it. Don't walk in there with 3 different electric toothbrushes. You don't have time to go through that. Vote on one. Everything in oral hygiene is very, very methodical. Create opportunities to increase retail sales by connecting to products, seasons are left off the other, and holidays. Make it to where it is enticing for them. Don't just, again, put something IKEA up, a bunch of products on there and everybody's. Motivate patient involvement. Remind patients to check all the retail areas in your office by pointing, showcasing. Sometimes I would see hygienists come out and showing a patient the product. Advertise online if you decide. Now, you know, I'm going to suggest something to you because I know some of you probably are having acid indigestion right now. I remember a time, Mark, you may remember this too, when someone said website, and the first thing someone said in a dental society was, are you kidding me? That's unethical. That's unethical. I wasn't there, but I'm sure the first time somebody advertised in the yellow pages, somebody said, well, the only people who do that is the attorneys. Plus it starts with an A. I'm not asking you to be mercenary. I keep doing this because I got Dr. Pankey sitting on my shoulder here. Advertise on, survey patients, get their feedback, and then do what I always talk about: scan, plan, implement, and reassess. Look at how you want to move forward. Here's what I think you're going to see if you do this right. You're going to end up with anywhere between 5 and 8% of your gross added a year that you didn't have before. Pre-COVID-19, I don't think you cared. You're going to care now, because I was very intrigued with Kirk's thing about overhead. PPE, seeing few patients, it's going to be a little tricky here for a while. So here's my last one. Bottom line, periodontal maintenance, recare appointment. Now these are, I stole this from Nancy. She's right on target. It's bread and butter your practice. First of all, it keeps your patients healthy because you're not going to do any more of this what? Fix and treat. You're going to manage. Does that mean a dentist has to go in on every single recare appointment? I'm going to leave that up to you, but I'll tell you exactly what's happening. What we're doing is we're not using the dental hygienist, even at the recare appointment, as a nurse practitioner, physician's assistant. You know, I trust hygienists. If you don't hire them. Don't hire those. But I trust them. They actually are doing your examinations for you after the new patient examination anyway. Let's just face it. So I know by my huddle in the morning, before we all get started, and I'm sure Mark always, you know, everybody gets together, you go through grand rounds, you go through every single patient, and then you move forward. But I know what patients I need to see, I know which patients I don't need to see. They tell me that. They bring it up on the screen. It keeps the practice healthy, it fosters relationships and referrals, like. It creates an opportunity to expand services. It's the lifeblood of the practice. But if you've got cancellation no-shows, as I started out this conversation, I stole this from Sally McKenzie. I think she's right on target. These are the 6 ways to stop it or slow it down. And I'm going to be very blunt with you. Quit appointing chronic cancelers on specific days. Tell them in 6 months, December, we're going to call you. Well, can't you give me an appointment? We have a new scheduling system, and I promise you, you will be the first that we call. You know who that is? That's the patient that we all walk around and say, you know, he's not going to show up. You ever heard that? He's not going to show up. Don't worry, he's not going to show up. You know when you're running behind, you know what you want? You want someone not to show, which is a self-fulfilling prophecy of not making any money. Don't pre-appoint these people. Every single one of you out there, I could give you a piece of paper and you could write down who they are. Don't do that anymore. Most important though, you got to educate the value of why they're supposed to come in. You know what we tell them that we really need them to show up because we're booked for 6 months. And if they don't show, we may not be able to get you in like we want. And then we imply that you're taking someone else's appointment. We imply it. Be clear on the appointment information, confirm, expand your hours, establish a policy. You come into our practice and you're 15 minutes late, you know what we do? Now, I can tell you what traditionally what we did. We try to charge them, okay? Or they know you have to charge them. You know what that does? Kills you. They're never going to show up again. They're never going to show up again. What we do is you come in 15, 20, 25 minutes late, you know what we do? We still see you. But Joyce, who got the call that you were running late, is going to very politely say to you, oh, that's fine. Please go ahead and come in. But you know, we will need a second appointment because we can't do everything in the first appointment. What she's implying is, why do you think we had you for 45 minutes in the first place? Got to work a PMI calculator. On the top is your periodontal maintenance, which is your 4910 if you're in the US. On the bottom is your 4910s plus your prophylaxis. It's very simple. You get this off of Dentrix or EagleSoft. It better be greater than 40%. Excuse me. So here's where we're going with this. Friends, I think the 60-minute appointment is over. I was already for the last 2 years telling you it's over. And if you're in a PPO practice, especially in a hardcore PPO practice, you are not going to be able to have hygiene appointments for 60 minutes. It's not going to happen. You can't pay a hygienist $40 when you're getting 64 from a carrier. It's not going to work. You already know what's it cost to turn over an operatory pre-COVID. Anybody know? $21. You know what it's going to be post-COVID? It's not going to be $21. So I strongly encourage you, and I'll be more than happy to help you with this, and that is moving it from a 60 to a 45-minute, and what you're going to cut is what you see in gold, because dental hygienists have been wasting time trying to disrupt biofilms for 30 minutes for things that are not going to make any difference whatsoever, and this is coming from a periodontist. You only need 15 minutes max at the chair in a recare appointment. 15 to 20 minutes max. That's what's eating up your time besides the doctor. So we've outlined all this. This has been, but if you look at this total time, that which really does it is the treatment phase, 30 minutes, 30 minutes. So you have to be very, very structured, very structured. In our practice, we started doing this 15 years ago, systems. Everything is there. When the dentist walks in, everything is already out, done, completed. And then he or she reviews it. And so when you do that, these are just systems that we've always used. You know, when I walk into the operatory, let me give you an example of what this says. That Yvonne or Joyce or Beverly, Maria, they said, Sam, these are the teeth that we're concerned about. If you're in the US, 2 to 3 is the worst. What's the problem on 12? Mesial. What's the problem on 19? Buccal-furca. What's the problem on 31? Buccal-furca. Very methodical. So I'm going to leave you with this. Perio is the #1 growth center. But to achieve that and be able to do the 3 mission statements that we discussed, and to keep from having what happened in 75 that happened in 95, is not fixing it with surgery or bone grafting. It's in addition to managing it with that, it's called the dental hygienist. So no matter how you do it, create systems. Create systems and checklists to be able to make this thing happen. You know, I learned about utilizing a dental hygienist more when I actually went in for a new, I had reached the point to where my internist had harassed me enough that I had to go in and actually have a colonoscopy. There was no reason, no symptoms for it, but you're supposed to have one. And what I found was I changed my practice the way this gastroenterologist ran his practice, in which he had someone that did all of this. And when he walked in his nice white coat and, Gucci tie, she began to tell him everything that she had found while he was actually examining me. And I said, wait a minute, how come I'm not doing that? Look outside of dentistry. Start reading things outside of just dental magazines. So I hope that you've been able to see that I absolutely believe the way you're able to get out of this issue with the new patient exam is that your hygienist is now the one who sees the new patients first and becomes your #1 confidant in that 2 45-minute or 2-hour sections. Number 2, I ask you to really look, if you have more than one operatory sitting there, to really look at dental assisted hygiene. And even if you don't have an extra operatory, if you have 2 hygienists with 2 ops, really look at what a quality dental assistant can do and help you. Number 3, stretch a little bit. If you want to know more about what I consider to be oral hygiene, Market Center. And I hope I've been able to suggest to you that the most valuable appointment for you long-term is going to be your recall appointment. This is me. If you email me, I'll be more than happy to send materials to you. You can either use this email address or the one I had at the very front, which is slow@dental.ufl.edu. And actually, let me do that for you, if you don't mind. I'd rather you use this one for me. Yes, slow@dental.ufl.edu. We will get both of those, but my team is faster on the responses when it's slow@dental.ufl.edu. We are here because we want you to be successful. And I know that we're going to come out of this. I'm already hearing very positive things. You're out there working, you're making it happen, and our patients are going to love us for it. So Mark, thank you.
Sam, thank you so much. That was extraordinary. You blew me away 20 years ago when you taught me at Pankey, and you're like a fine wine. You just keep getting better. A quick thought that struck me with your product discussion when we're having patients sitting in their cars, texting them to come straight into the operatory and back out, that's going to compromise our product center. Can you comment on a way to deal with that, or a way to build value when they're not going to be in the reception room very long?
Yeah, and you know this because I admire you for this. They're going to be dentists that are going to figure this out, aren't they? They're going to be dentists that have already started.
From calendar.
There's dentists that already started figuring this out before they got 100,000 emails from people trying to tell you how to figure it out. But, I always go towards the core. Simple things. First of all, you've made a very good point. What's going to be the #1 issue? The #1 issue is going to be relationships. The #1 issue is going to be relationships. The #1 issue is going to be, I'm wearing all of this stuff. You probably have already experienced it. I saw someone, one of my properties is a condominium here on the ocean in Florida. I saw someone in the elevator. She started talking to me like she knew me. How do I know you? I mean, you know, she had an N95 mask on, by the way. I don't know who you are. I do believe that teledentistry, used the right way, is going to be probably one of the most important areas we have. I'm not talking about getting new patients as much as establishing relationships with patients. Because, you know, Mark, you're not going to be able to take them into your office like we did before. Now, I really believe the things I went through, I don't know, I know you're younger than I am. I don't know if you went through the HIV, but there are incredible parallels between what happened in HIV. The same thing, dental school enrollments went down. Dental applications went down. You couldn't find a dental hygienist. But then after 3 to 6 months, what happened? We persevered. So I'm going to suggest, as in answer to your question, I think you're going to have to do more teledentistry. I think you're going to have to, yeah, but you know something, if you're only seeing 6 patients a day, you got time to do teledentistry. I think you're going to need to do teledentistry. There's multiple platforms out there that are HIPAA protected. But that's what I would do. I think that's the only way I know, until we come to our senses and realize that we're not going back to where we were. That same thing happened with HIV, but my goodness, we don't have to have a spacesuit to see this. And, you know, and that's exactly why I admire the ADA. Almost all my information that I've used in my consulting with companies, everything has come from the Health Resource Center. I mean, I really give them a lot of credit. I didn't know what was going on in dentistry. Those surveys that they did, plus them being able to give me interim guidelines, you know, that was very positive. And I just realized that, is Kathy following me after this?
She is, sir. And then Kathy's going to go, and then Christy's going to go next.
Sorry, Kathy. I didn't want so many accolades. I forgot you were even following me until I saw your, but I do. I mean it from the heart. If there ever was a time to be in organized dentistry, and you know something, all that information was for also who? Non-ADA members. Not ADA member, but non-ADA members. ADA stepped out of the plate more than I've ever seen, but we never had a crisis like we had. So,
hey, if you enjoyed this week's episode of the Best Practice Show podcast, we invite you to check out actdentalu.com. ActDentalU is the essential resource for anyone at any stage of starting, growing, or running a great dental practice. Whether you're just getting started or whether you're a well-established dental practice, ActDentalU can help you and your team get to the next level. With our extensive course library and all the current best practices in dentistry, and our Friday master classes and workshops for you and your team, and a supportive, active community to help you along the way with encouragement and feedback, ActDentalU is the perfect place for any dentist to create a better dental practice so that you can have the freedom to enjoy a better life. So check it out at actdentalu.com.